On today's episode, I'm joined by the author of multiple New York Times bestsellers, including Dopesick. She goes into stories from her brand new book, Raising Lazarus, which tackles the ongoing opioid epidemic by uncovering big pharma corruption while showcasing those who risk their careers and their lives to fight against this man-made drug disease that continues to plague America. So without further ado, here is my conversation with the Emmy-nominated, award-winning author Beth Macy, and this is Uncovering the Truth. Beth, thank you so much for coming on the show today.
Yeah, thanks for having me.
Absolutely. Well, let's just get right into it. I want to start with a quote that you wrote in the book Raising Lazarus, and it just gives me the chills. And you write about the victims of OxyContin, quote, "These are not moral failures or criminals, but these are people with treatable diseases." So do we stigmatize the victims of OxyContin, because it's psychologically easier for us to blame them as opposed to swallowing the reality that there could be a company like Purdue Pharma that is so evil and it's right in front of our very eyes?
Yeah, I mean, I think stigma is really at the basis of the fact that our main forms of dealing with opioid use disorder and the folks who have fallen to that are to incarcerate them, or to just let them die, to medically abandon them. And if you go back to what Richard Sackler said in the early days of OxyContin, he said, we must hammer the abusers. They are the criminals. They are the culprits. It was easy for him to say that because he knew that America has long stigmatized drug users because of the war on drugs, which was really a war on Black and brown people. It was designed to be racist.
Yeah, I was blown away at the sheer sadism, because I thought it was, this is certainly a problem of greed, but to me, even more when I look into it, I'm like, this is more, these people, it's almost as if they like what their drug and the effects it has on the population. They see the death rise, they see the death toll, and they ignore it. So I want, is there a, is this all stemming from the companies, this stigma that we need to blame the abusers? Or is this something that we as a society can uncondition ourselves from? And this was there before Big Pharma came in and planted this message.
Yeah, I mean, I think it was there going back to really the Harrison Narcotics Act of 1914 that made heroin and cocaine illegal at a time when I forget the number, it's in the book, but a whole ton of Americans were legitimately being prescribed those drugs, or you could buy heroin over the counter. Back in the late 1800s, it was designed by another rent-seeking corporation to cure addiction to morphine. So, just like OxyContin was supposed to cure moderate pain but not be addictive. So, like this kind of swindling has been going on for many, many years, but it really picks up with the war on drugs, which is declared in the early 1970s by Richard Nixon, who is trying to, shore up his Southern strategy, which is, basically to make white voters vote for him because he is, really going after, he creates the system where Black and brown people are most likely to get incarcerated for drugs, even though they're not the largest majority of drug users. So before that, though, and this is a story I think really bears repeating if we want to get out of this now, is when the veterans started coming home from Vietnam addicted to heroin, Nixon, again, hoping to shore up votes among veterans and supporters of veterans, started this on-demand system, clinic system for methadone clinics. There are 300 methadone clinics all around the country that people could go into for methadone and social supports and help with housing. And that's really the idea that we need to get back to. That was kind of pre the war on drugs, back when our funding stream was 30% incarceration, 70% treatment. And then the war on drugs happens, and gradually that formula exactly flips. And that's where we're at today. Most of our addiction dollars go toward incarceration. We've got to get that back in balance.
Wow. So to me, it sounds maybe at a national level, this is being neglected or simply brushed away by just throwing them in jail. And you know, I know there's the new crisis, the fentanyl crisis, and there's a major political party. They simply blame immigrants for all of it, for bringing the drugs in, and we need to close the border. But that to me, again, is creating yet another stigma just against immigrants. It's not solving the drug problem in America. So I want to, because you were a local reporter as well. And do you think that we've sort of neglected local communities and we're just so focused on national issues that we're not solving the problem, we're just talking about it?
Absolutely. I think that, and it's a hard problem to tease apart, but a lot of these issues came up at the same time. You know, my first book, Factory Man, is about the aftermath of globalization, particularly in communities where all the jobs went away, or most of the jobs went away because they got shipped overseas. And those are the same communities that Purdue ends up targeting with their message that this new super powerful drug is virtually non-addictive. And then you see a lot of pill mill doctors popping up. And so that people who have lost their jobs, but everybody's got to survive, right? A lot of them end up getting addicted. And not only are they, you know, treating their pain with this drug, but they're also selling it so they can pay their bills because they can't find jobs anymore. And people would say they should just move to areas where there are jobs. But, you know, historically, and this goes back millennia, people don't just move because maybe people with college degrees do, but most Americans don't have college degrees. And people who don't have money to move or social capital to move or connections to move, and they don't have family in other places, they're not going to move. And again, that's the blame the abuser. That's the blaming the victim for the problem you caused. The government let these jobs go away and did very little for the people that were left behind. And then failed to regulate things like OxyContin so that when this comes along, they can just, I mean, it's like government impotency at every level.
It sure seems like it. And I was blown away. Even just, I truly believed the FDA was, I mean, this is not, I'm not going to make a blanket statement, but I truly believe the FDA was a thing you could trust before I got your work and understand that they accepted labels that were false and misleading.
Yeah. And if you've seen the Dopesick show on Hulu, like we had a document that, you know, it was a fraud department document that showed that Purdue had rented a suite of hotel rooms right down the road from the FDA. And they actually, you know, wrote that label together with the guy who eventually stamped approve on this bogus label. Well, it wasn't bogus. It had it looked like it had legitimacy to it, but you know, there were a lot of things that were misstated. Especially the risks were misstated, and there was really no research done to prove the safety of the drug. And nonetheless, it gets approved. And lo and behold, 18 months later, the guy that approved it at the FDA goes to work for Purdue Pharma. So that's what we call revolving door 101. And we've really got to put up some guardrails on that.
We have to revolving door, especially around, you know, politics too. It's the congressman turned a lobbyist and you make a killing and you're doing the same job without having to vote. So, but I think what's interesting about that is, again, they place all of the Big Pharma, Purdue, they place the burden of proof essentially on the people, because there's no regulation. So it's almost as if we have to be such smart consumers in the 21st century. And it truly makes me believe I know that's why you write about the stone rollers in Raising Lazarus. Without these sorts of local heroes spreading the word and even risking their lives and risking going to prison, helping these victims, it's like it's still a battle against people versus the corporations in a certain sense. So
Yeah,
I would just love to
it
hear
is.
also. Yeah.
I
So,
mean,
and
there's
you're,
a scene near the end of the book where I'm following this Ryan White HIV worker around, and she's also a harm reductionist in her spare time, of which she has very little. uh, and she's trying to find these folks who told them they have HIV, and they're getting kicked out of their homeless encampments right and left. So she can't even find them to tell them. And as we're looking for a particular person one day, I just, in our daily, you and I are people of privilege, and in our daily goings on, we might see homeless encampments and whatnot, but it's not in our habit to like just look under the cover a teeny bit. But that's what Brooke does. That's her job. And to see that world opened up to me was so moving. I'll never forget it, because like we're just looking for one person, and the need that's out there is so incredible that she can't even get to it. I don't even know how they do this work. And she's a person in recovery herself and vulnerable to relapse because it's so stressful. But we run across this man who's just dope sick in a wheelchair. His legs are so infected, he's going to die if he doesn't get on IV antibiotics. And he won't go to the hospital because he's been there the week before and they just stigmatized him and treated him like crap. He's not going back. And at the same time, she's like trying to treat his wounds with little tiny packets of antibiotic salve. The cops come and put up an eviction notice, but at a riverbank. Like,
yeah,
who cares that these people are living on a riverbank and like don't care at all about the human beings in it?
Well, that's just it's funny, the homelessness issue is something, because where I'm located in LA, that has just been the number one politicized issue, and we've completely dehumanized them to the point of like, let's just get them out and throw them in prison so we can keep our community safe. But that's not my belief. That is the consensus, and that's kind of the battle where, and it's like but there are, I didn't realize there were even harm reductionists. I didn't even know that was a term. I just thought the only way you could solve this is through rehab, and I'm clearly wrong. And there are these people. Is that why the title Raising Lazarus? I just love that.
Oh, thanks. Do you want me to just explain it?
That would be great too.
Yeah.
You would explain it much better than I would.
Well, I don't know. It takes me a minute to get there, but if I'm not landing the plane, just like go Beth, just bring it in. But no, a lot of people think the title is from Narcan, which is a wonderful drug. It's the overdose reversal antidote. And of course that is part of harm reduction, because you can't get dead. You can't get in better if you're dead, right? So first we got to bring these folks back. But the reason I called it Raising Lazarus is because I was following these harm reductionists, these two women who are married. They run they run the nation's only queer, biracial, faith-based harm reduction group. It's called Olive Branch in Hickory, North Carolina. And there's this moment where one of them, the Reverend Michelle Massis, has been called to this little town in North Carolina, which is actually the setting for the Andy Griffith show way before you were born. But, it's classic Americana, like, celebrates the wholesomeness. And just barely under the surface, this town actually has the second worst overdose death rate in the nation at the time. And nobody wants to do anything about it. And so Michelle's called over, it's an hour and a half away, to give them advice. And it's this meeting of church volunteers, and they're gonna like create a volunteer network of people to drive people who live way out in the country and suffer from addiction. This is also one of these towns that was full of pill mills at the height of OxyContin, because that's where these problems are the worst. And they're going to bring them into treatment.
So I gotta just really quick, that pill. Could you describe what a pill mill is?
A pill mill was a quote pain clinic where, I mean, they weren't all like this, but what usually gets deemed a pill mill was a pain clinic where folks could come and get written prescriptions without a lot of proof of their
Oh,
injuries. And the doctors were making a ton of money on it. A lot of them became paid spokesmen for Purdue. So this was one way that if you got sucked into being addicted to pain pills, you could go, or even people who just wanted to deal pain pills could go and present with a lot of symptoms, and they would write you these. And a lot of the teenagers that I first profiled who were addicted here locally, where I live in Virginia, would get their pills from a person who actually had an injury, but they prescribed so many of the damn things that then he would sell them to them. I mean, I know so many kids that got hooked that way. And then once they crack down on the pill mills, the person's going to get dope sick if they don't actually have opioids, this flood of opioids in their system. So that's when the cartels started bringing in heroin, knowing that they were chemical cousins, because one's fear of dope sick is a really great, business proposition. Like, they're going to make money on it. So, but back to the Lazarus story, this meeting of church volunteers, the meeting just went haywire, and one woman hijacked it entirely by saying, I think when they overdose, we should let them die and take their organs. And, nothing happened. And it's this idea of NIMBYism. I call them caves, which are citizens against virtually everything. And Michelle, the harm reductionist there, who's just there to try to help, tries to remind this group of, quote, Christian people that, this is not what Jesus would do. And she tells the story of Lazarus to get them to check their own blind spots. She said, Jesus performed the miracle, but it was the disciples in the community that had to roll the stone away from the tomb and tell Lazarus to come out. And then they had to get close to him to take the burial cloths off of him. And she says, it's stinky work. You might get a little mess on you, but only by getting close to the issue are you going to experience the miracle of raising Lazarus. And so, she tells that story, and eventually, because of some really great people who, they start to work on their problem. And so the book is really a guidebook of how to get past these political divide that keeps so many people from being able to access treatment. We have a treatment gap of 87%. That means that only 13% of folks with opioid use disorder, or OUD, were able to get treatment in the last year. That's a big old F. So that's what we've got to work on.
Yeah, telling them that's the treatment. And so you brought up an interesting topic there, which is, I think, religion. And they were sneaking in cards that said they worked at a ministry. So if their family or friends of the victims of the opioids saw it, they're like, oh, it's Christianity, it's a church, it's okay. So, but I'm wondering though, is religion as well? Because I think there's still around 60% that believes in creationism. So religion is a huge part of American culture and society. Do they believe, not to put a blanket statement on them, but are they against medication and these sorts of other treatments like the methadone, I believe, that are used to wean off of it? Is this another barrier that we have to overcome, and even religious people who fall victim to these drugs?
Yeah. The idea is that, let's get back to the basis of Christianity. Jesus wouldn't have just cast these people out. I mean, I'm not a religious person at all. I didn't grow up going to church, but when I hear Michelle talk about why she does her work, I am sold. I'm like, sign me up, because y'all have figured it out. And she's the only harm reductionist that I ever heard say, you got to meet the naysayers where they are too. The harm reduction always says, you got to meet the addicted folks where they are, in the homeless encampment, under the bridge. You've got to, because most of them aren't in any kind of system of care. the folks camped out in front of a Pottery Barn in LA. They're just been cast aside. And the idea, and they don't want to get better because they don't think they can, and they haven't been able to access treatment before. But this idea of meeting them where they are in use, giving them clean needles so they're not spreading disease around, using a needle 100 times and sharing it.
Right.
That's how we've gotten this hepatitis C and HIV spike right now.
Mhm.
And then once the trust begins to be established, the harm reduction approach becomes a gateway to treatment. And we know that the medicines are way more effective than the abstinence-only faith-based rehabs. Now, that works for some people, especially if they're people who were brought up in church and they believe that. And a lot of the faith-based rehabs, they really do help people with some of them are free. They get their teeth fixed. They help them with their charges. They take them to court.
Mhm.
I had to check my own bias about that because I was so like MAT, the medicines, medication assisted treatment. And then I'm like, no, wait, this works for some people. And if that's what you believe, then that's going to work with you. If you don't believe in the other stuff and you've had a bad experience, the idea is that everyone should have access to the full buffet of treatments.
I think so too. And speaking about, meeting people where they are, I think is, again, you have to undo the stigma first of recognizing that there is a human being underneath with a soul and they want to get better. And although sometimes it can be scary though, because again, the stigma that we have of homeless people, at least that's painted here, it's scary to even talk to them or approach them, but when it's a family, friend, or relative, we know that we know that there is someone in there who wants to heal and wants to get better and wants to cure this disease. So is there another, aside from approaching them like as just a normal person, is there something more that society you think needs to do to begin to overcome this crisis?
Yeah, I mean, we've really got to begin to unwind the drug war mentality, and we've all been brought up in it. I was born in the 60s, but raised in it, like this idea of people who do drugs are terrible. And, the only way to deal with that is to put them in jail, lock them up. But why is it that the Sacklers get to walk free, but, your cousin that works at Subway, who was like using a user amount of dope and got caught, is in jail for years? I mean, that's just, it just shows you the unfairness of the, billionaire justice. And so we've got to begin to work on that treatment gap and offer folks who are in chaotic use access to evidence-based treatments. And I mean, it's just as simple as that, but it's not like you can just go out and find them and pluck them. We have to make that system of clinics that Jerome Jaffe designed in 1971. We can do that again. We've done it before. But it's going to involve like changes at every level. It's going to involve changes in the way people are jailed and diverting people into treatment instead of immediately into jail. It's going to involve treatment in jail. Most sheriffs, elected sheriffs who are running on these tough on crime platforms, hug a thug, they call it, offering them treatment. We've got to begin to change that, because when people get out of jail and they're addicted and their addiction hasn't been treated, they're then 29 times more likely to die when they reuse, overdose and die, because they've been opioid naive. And if they go back and now fentanyl's on the streets, that's when people are more likely to die. So we've got to meet them at that moment when they get out. And so that's why I spend a whole chapter or two on this jail in Fairfax County, Virginia, that's really figured it out. And I'm telling you, a lot of these innovators are women, that's run by a sheriff, and they're just women who are getting shit done right and left. And, so this particular sheriff, like, her jailers didn't want to do it. We're going to give them buprenorphine in the jail. Well, a lot of them are in jail because they were selling buprenorphine illicitly. And we can go into that if you want, but she's like, no, they're just cycling in and out. We're not doing we're not rehabilitating them. So, and part of this is a harm reduction group that like meets the sheriff and says, we got to start doing this. Sheriff brings in counselors, locates them in the jail, Like, that's really unusual. The office is in the jail. And then these peers who are people in recovery come and go to the jail to make relationships with these addicted folks in jail. And the deputies don't like that either. They're like, we're going to let felons just come in and out of our jail. And, they brought consultants in to teach them the science behind why this medicine isn't the evil of all evils. And some still didn't get it. And they had to be let go. I mean, we've got it. It takes courage, because like those deputies could have all turned against her and she could have lost her next election. Right. But, she figured out she had the courage to make change based on the health of her community, not just getting reelected.
Wow. And so that's seeking reelection is something that should not be the priority. But just to speak to that, it's funny. You even just make me think again, like, what is the purpose of jail? Is it to make our society safer and keep criminals off the streets? Or is it to solve their problems in there and hopefully they come out, if they come out and if they haven't committed a serious crime like a murder, but to heal them so that they can be reincorporated back into society? And I just wanted to, one more thing. So that was interesting. You're enlightening me on the spot again, Beth. I thought this is just my being naive. I thought if there was someone who was addicted to drugs and you just threw them in a sobriety tank, that they would go through the suffering and pain and they would become dope sick and it would be agonizing and cruel, but eventually they would be weaned off. And clearly, if it's 29 times likely, I'm completely wrong in believing that the sobriety tank solution is the equation.
It doesn't work. I mean, occasionally you'll hear stories like, that was my rock bottom, jail, and I wasn't going to put my family through that again. It's just, addiction, everyone experiences addiction differently, but the research is very clear that is such a moment when folks are most vulnerable to relapse and death because our drug supply has gotten so much more poisonous. So this idea of there's a model out there called law enforcement assisted diversion, and that is this idea, and they won't offer it to people that are out there selling huge amounts of heroin, right? They're offering it to users who need treatment. They'll divert them. I got a story about a woman. I met her in a trap house. I was with a needle exchange. Her name's Billy Campbell, and like that was a cool reporting moment, because what reporter gets to just go in and out of a trap house? But I was with this person that she trusted, and she let me spend the day at her trap house, and she was actually giving out clean needles while she was selling heroin, and people would disappear into the bathroom to use and come out and whatnot. And they all seemed miserable, to be honest. And a few days later, Billy gets arrested bringing a huge amount of heroin back from Winston-Salem. She gets arrested, and the cops all know her because it's a small town. They've arrested her before. She spent most of her adult life in and out of prisons and jails. She's a very smart person. And one cop who's been made a relationship with a harm reductionist in town decides to do things differently. He says to her, Billy, what the hell are we going to do with you? And she says, why don't you get me treatment? Then she'd never been offered treatment before. And so they called the brand new post-overdose response team that this county had the foresight to create. And here comes this peer, a person in recovery who's a kind person, and drives Billy to a treatment center an hour away. And so I got to watch this woman go from running a trap house, being in jail, going to treatment. I mean, she's now been sober for 15 months. It's the longest time she's been sober since she was 12 years old. And she's like in her 40s. And she went to a faith-based harm reduction. I mean, a faith-based rehab. And it helped her. And it helped her for a while. She eventually got kicked out for vaping.
Yeah. Oh gosh.
Yeah. But by that point, she had connections with these peers, and one in particular just enveloped her. A family member saw that she was really trying, that this time seemed to be different. And I'm in touch with her all the time. She's doing great.
Yeah.
She has a job.
That's fantastic. And I just, because you as what's interesting about you as a journalist, because I think of your work as a journalism more than being an author, right? Or like a bestseller, but uh, you've clearly, because of the show, the Hulu show, and the success of your book, Dopesick, it's propelled you to a sort of spotlight. And I'm interested because you have to spend your time as a local community. You need to earn the trust of these communities to report on them and get close to them. And you're in trap houses and you visit prisons. And how do you combat sort of the undo the media attention to try to, reincorporate back to these communities and continue your work? Is that a challenge as a
Well, I don't
journalist?
know, because the Hulu show is kind of brand new. I was doing most of the reporting before the show came out. I was already a best-selling author, but these people don't tend to know that. I mean, I'll be honest with you, that jail that I profiled that wasn't doing things the right way, that had twice as many people as they should have. People were dope sick in the intake area. I mean, they only let me in because I was Beth Macy, an author that they had heard of, but they thought that letting me in would buttress their argument for building a better jail. And to me, it just buttressed the our argument for treatment and diverting people from jail. So, but again, like, they haven't read all the research that I had. So it's really an educational. I don't think these cops are all necessarily bad people.
No.
I mean, they legitimately thought if I saw how crowded they were, I would think the answer was a bigger jail. No, the answer is to put humanity back into our institutions. I mean, they're getting their bigger jail because it was already underway, right? But being like, having your name as an executive producer on a Peabody winning show and being nominated for Emmys, that doesn't make what I do easier. I mean, it might get me a call with the drug czar, but it's not gonna like help me out in the communities, which is what I most care about. And I met somebody at a needle exchange in Roanoke, which took years to get to open because of all the NIMBYism around it. And when I got there, because Roanoke had never had one, and then I see it and it's like, oh my God, this would have helped so many of the people that I saw just, be abandoned and die, because it would have given them a place to go. It would have given them connections to services. It would have helped them not get hepatitis. And it was just this very moving moment. And there was all kinds of people, older folks wearing Trump hats, and middle-aged people wearing Grateful Dead t-shirts, and young 20-somethings with their dogs, and they could get food, they could get clean needles, they could get connected to Medicaid, help with jobs. I mean, it was like, this is urgent care for the addicted. And it eventually got shut down because one of the neighbors was pissed off because of the needle litter. It was basically, he didn't like homeless people hanging out outside of his floral shop, and there was a way to deal with that. But anyways, they're still going, they're just mobile now.
No. Yeah.
But one homeless woman goes, "You're Beth Macy?" And I was like, "Yeah." She goes, "I read your book, Dopesick." And then she proceeds to tell me how, like, when she fell asleep in her homeless encampment, someone stole the book from her.
Oh my God. So many layers deep of.
I know,
I
so
can't
many
imagine
layers.
reading that book while. That's fascinating, but also disturbing.
They're smart people. They're smart people. I mean, nobody's more clever than a person that has to get up and find a way not to be dope sick every single day. And if we could harness that energy by helping them get into care, I mean, that's Build Back Better, Right. How we can get all this money for jobs, but like in places like Mount Airy, which I write about, like, they can't get anybody to pass a drug test. So they have all these jobs they can't fill until they start dealing with the demand for the drug, which is offering people care and treatment and meeting them where they are until they're ready to go to treatment, and helping them make incremental improvements in their lives. We're not going to have a workforce for all these supposedly jobs that we're going to build back better.
And I think one thing you said about there is education, that the officers, the guards, it's not that they're so evil or that they want to just throw people in jail. Now, maybe some of them are, but a lot of them, they are truly, there's a disinformation going around, and just a lack of knowledge about what these drugs do, how they change your brain chemistry, how they turn you into a dope sick where you feel like you're dying unless you get your next hit. And as well as it's going on in politics too, there's just so much disinformation, but it's being propagated by the corporations, by the politicians. So where we are right now is a lack of knowledge and information. And I think it's one of the reasons I like, bringing on journalists like you to tell the truth. And because once again, I see this has been the opioid epidemic is, what they call it. The opioid crisis has been going on, but the mainstream media does not cover it. Like, and just a quick example here with coronavirus, which was another awful pandemic. They had a death toll running on the screen, which I thought, I'm like, that's very powerful. That is very powerful to see the number ticking up by the thousands. But why don't we have that for the opioid epidemic, which has claimed over 1 million lives? And still today,
no, they weren't even counting it. I mean, I was the first person to report that it was 1 million. The media would just report the latest thing that had been reported and recycle it. But I actually went back to the actual data. When OxyContin started in 1996, if you brought it all the way up to date, it was well over 1 million. For years, they reported it was 500,000. I mean, I know that's a little point, but just like the accuracy, there's fatigue with the issue. And yet we have a third of American families, and I think that's a lowball number, have been affected by this. I mean, we all know somebody. I'm sure you know somebody. And we all know somebody. And if you think you're insulated from it because you have social capital and you have some manner of wealth, you're not. This disease like spares no one. Or you're just one accident away from being overprescribed. And I don't know. I could go on forever.
No, yeah, you should. I like, but when I was actually I was brought into not even surgery. I think my lips were extremely chapped, sunburned. I came back from vacation. I forgot, and it was awful. I could barely like move, and I went in. And sorry to gross the listeners out with that, but anyways, the doctor, without asking, he said, "All right, I wrote you a prescription for OxyContin," and I think I was
for chapped lips.
Yep. I was about 18 years old. Yep. Because I was in excruciating pain. Right.
Yeah.
And I'm like, that's not working. You can't touch it. It's going to hurt my. So then the guy, barely resistance, offered me OxyContin. But this is before I knew. I'm like, but I knew it was an opioid, and I had a stigma against those. I'm like, isn't that like a heroin, my gateway drug to heroin? So I said, thank you. I didn't take any of it because I was against it before. But I was like, oh, and when I saw Dopesick in the book, I'm like, my goodness. Could I have been addicted? Like, and I think of myself as a strong-willed guy, but does it get you? Does it get anybody who takes it? And I'm blown away at the addiction potency that this pill has. And is it still a problem today? Or I know Purdue filed for bankruptcy. The Sacklers faced zero consequences, but is OxyContin still plaguing the country? And we've just moved on.
The CDC issued guideline, and that's been controversial because there's a lot of chronic pain patients who think that doctors have gone too far the other way. And it's not cool to like just yank somebody off the amount of meds they've been using carefully and not misusing either, because that send a lot of them to the black market because they have a dependency / perhaps an addiction too. What we need to do is our doctors need to be better educated. The average number of hours that a physician gets in med school on addiction and pain is 1 to 4, I've been told. Now, I have some friends who just graduated from Harvard Med, finished their residency at Brigham Women's Hospital. I just had dinner with them last week, and they had just taken their boards. It's a 9-hour test. And these are young people who are going to save the world. They're just so freaking awesome. And they said, guess how many questions on the 9-hour test dealt with addiction? 1 question. And the question wasn't even right. Like they knew what the answer was supposed to be, but it was a poorly written question. Like, Like, we've got to change the way we've got to demand, because a lot of our taxpayer money goes to graduate medical education programs that's still turning out young doctors that can't identify and accurately treat addiction. I mean, there's so many things we need to do, and I sort of outline them all. I try to keep it in the new book. I try to keep it a nonfiction narrative that will keep one interested.
Yeah, oh,
It's
yeah.
not all just grim stories. It's really people who are inspiring, who are figuring out workarounds and end runs around these really bad laws and rules and regulations. And they're frankly so inspiring that this book was easier to do than Dopesick, which was just left me feeling so bereft.
Right. How did how did you, like, you wanted to tackle this again? And I know, yes, you feeling so empty after, as anybody, as any human being would, but this, I think, so you're coming into this one with hope, which is on the cover as well. And do you see, where do you see the oxy epidemic right now? Do you have hope that we can overcome this with people like harm reductionists and the stone rollers and the brave doctors who are sacrificing everying to,
and the brave sheriffs, too.
Sheriffs?
I am hopeful because there are people out here who have decided that what we've been doing since the war on drugs began isn't working. It's just not working. So there are people probably in every community. There's someone who has actually educated themselves about this and knows the best way to do it. But we've got to just start supporting them. We've got to offer, the government needs to incentivize, sheriffs that are reluctant, and hospital administrators that don't want to treat addiction in their EDs, that's where people are showing up with abscesses and overdoses. And so most hospitals don't offer addiction treatment from the ED or a portal into care. We've got to change that. There's just a million things we can do. And by telling the stories of these courageous people, I keep coming back to the word courage, who've just decided what they were doing before isn't working. Why don't we do the research and then do it and try something new? And I learned this from a rural judge in Tennessee, an elected official, right? So he's got to worry about re-election if he wants to keep his job. He totally transformed the way he deals with people who are addicted in his court. And he's in 10 counties in rural Tennessee, which is one of the epicenters of overdose deaths. He has reduced deaths by 50%. He has reduced NAS, neonatal abstinence syndrome, babies born dependent. He's reduced that. I can't remember the number, but it's significant. It's at least by half. And when you sit in his recovery court, like, you have never seen a judge be so thoughtful and so kind with these folks. He knows every one of them. They come once a week. There's a team meeting, and the doctor gets to make the decision about whether they're going to go down MAT or not the judge. He cedes the authority to the physician on his team. And at the end, he tells them, if they've had a good week, he says, "I'm really proud of you." And he walks out from behind his bench and he gives them a hug, and they know he cares. It takes about 5 extra minutes for him to treat them like a human being with a treatable medical condition. And his results are fantastic. The US Supreme Court gave him an innovation award a couple of years ago. So we know how to do this. We're just not doing it at a scale to match the scale of the crisis.
That's inspiring. And it starts at the local level, and they should get more attention, these sorts of heroes. And I just really quick, you actually mentioned something in there that I think we'd be curious to hear. I didn't hear of that term, babies born dependent. Is that what I think it means? Is that as bad as it sounds?
Yeah, it's neonatal abstinence syndrome. And it's when a mother has used opioids throughout her pregnancy, the baby is going to be born dependent.
Oh my.
And which, there's a lot of judgment around that. But in a lot of these mothers, they had no help while they were pregnant. And babies aren't born addicted, because addicted means like you are your behavior has changed based on your dependency, and you are doing things that are not favorable to you. babies don't have that kind of will. So babies are born dependent. They didn't choose to be in this situation. And what happened with that particular judge, his name's Dwayne Sloan, he adopted an NAS baby, and he got to know the birth mother, and he saw that, and he was a former prosecutor that was totally against MAT or buprenorphine, Suboxone. And he got to see her, that literally she's willing to give up her child because the only thing she can think about when she wakes up is not being dope sick. He sees it.
Oh.
And then he's like, what we're doing isn't working. And then he admits he was doing it wrong. And that's another key piece, I think, to making change. You got to have folks like Judge Sloan or a profile an ED doc in Roanoke here who decides he's been doing it wrong. He admits it. And then he does things differently. And those people have so much power. Like they're these little bailiwicks, you know?
Mm-hmm.
And we just need them to use their power for good, to be honest.
It's true. Well, it can't be swayed by the corporations. Well, luckily, the Purdue Pharma cannot sway them anymore because they're filed for bankruptcy. But the people are immune. I hated that they were granted immunity from future suits, and they're able to.
It's an appeal. So
it's an appeal.
So
that's currently,
because it's a super wonky story. As John Oliver said about it, he goes, when people want to do evil, you wrap it in something really boring so nobody can understand it. I love that
that's
quote.
Great. That's perfect. That's exactly.
But they, facing 3,000 plus lawsuits from cities and counties and tribes, Purdue files for bankruptcy, and they don't file in Connecticut where they're from. They file in White Plains, New York, because there's only one judge on bankruptcy there, and he is known to favor what's called a third party non-consensual release, which would basically give the Sackler family owners, who are not bankrupt at all, protection or civil immunity against these cases in exchange for, they're going to give up the company. And it started at $3 billion settlement. It's now up to $6 billion, but it was appealed. And the first judge looking at it, Judge Colleen McMahon, said, no way do the Sacklers get the right to not be sued. No way does somebody who lost their kid to OxyContin not have the right to sue the Sacklers because of some bankruptcy judge. I mean, she just called it like it was.
Right.
It's such an insular kind of bankruptcy boys court. So in the book, I decided to tell the story through these activists that are really trying to get the victims' voices heard. And one pro bono lawyer who's facing off against these Purdue lawyers that are making $1,790 an hour. They're just making bank on this case. And as Patrick Ryden Keefe has said, he wrote the great book about the Sacklers called Empire of Pain. He's like, it's like the emperor's new clothes. Nobody wants to call out what's actually happening. And so where I landed on this book, which, I had to finish some months before it came out, and I didn't know what was going to happen, whether the lawsuit would be settled or not, the bankruptcy. And of course it's not. Still, everything takes longer than you think. Is like just the overarching idea that given that this is the way our system works, what's to keep another millionaire that wants to be a billionaire from launching another life-threatening drug, getting approval from the FDA because they know somebody on the inside, and creating another epidemic, and then skirting away by paying a fine. And they're leaving with, let's say they're paying $6 billion. We know they made $13 billion. And we know a lot of that is with third generation relatives socked away in trusts and offshore accounts. We don't even know, the prosecutors don't even know how to get at that money. Yeah. They're so smart. They're like, one person said, they're playing chess while the rest of us are playing checkers.
Yeah.
Where's the idea that I'm not going to do this because I'll get in trouble? No, I'm going to still get to go away with my wealth. There needs to be, consequences.
There should be prosecutions, not just fines and indictments, right? And of course, the DOJ blocked the indictment. So I guess that this comes back to, because you said you have this quote that also, like I said before, you just gives me the shakes. I'm like, man, this is serious. And you say the real crisis was not the overdose crisis, but it was underlying it, and the crisis that underlies every other crisis, which is greed. And so is that where it's a battle against greed, and it's incumbent upon the stone rollers to rise up and fight this and try to at least, get on a national level to
I mean, we
Right.
need bankruptcy reform. We need to stop the revolving door. Elizabeth Warren has actually talked a lot about, like, she knows what's going on.
And she's a tough too. I like her.
Yeah, she's tough, and she's a bankruptcy expert. Katie Porter literally wrote the book on bankruptcy. We need more people like that to be in Congress, and we need better elected officials. But first, we've got to change. We've got to educate the public on, if we really want to turn back our soaring deaths of despair, we've really got to become educated about what's causing them. And so that's why I wrote this book. I didn't want to write another book on the opioid crisis because it was so bereft at the end of the first one. But I'm like, then I started learning about these people who really were like doing innovative things to put humanity back in our institutions. And I thought, I've got to just celebrate these people, so that when this money does begin to come down, there's already some money coming down from the distributor case, that the money won't just go into the same old abstinence only drug war programming.
Right. And I'm just curious, like, I don't want to hold you too long, but I wish I could talk to you for the whole day about this. But I want to ask you just real quick about because where we are now currently, the fentanyl is I believe the #1 killer in the country. And I'm curious, because like you said, what's to prevent somebody from rising up and doing this again? And the answer is nothing. If there are no prosecutions, nothing. So, because they're going to make a lot of money from getting people addicted. Like,
what's the deterrent? That was a word I couldn't think of before. The deterrent.
The deterrent. That's better. Yeah, that's. What is the deterrent? And so, but with fentanyl, at least if I'm no expert on this, but it seems to me fentanyl is, because I actually know someone who accidentally, a friend of a friend of a friend, they snorted a line of cocaine and they passed away because the cocaine had fentanyl in it. So is fentanyl first of all, is it being snuck in to other drugs? And secondly, why is it being snuck in? And then I guess thirdly, you can answer whatever, but is this being prescribed from above once again? And is this another drug or is this more of a street drug? It's a street drug. It's
a street drug. Fentanyl was developed, like, I had a outpatient surgery a couple of years ago, and when I woke up in the recovery room, I heard him talking about giving me fentanyl. I mean, it is a legitimate drug that was prescribed. It's a very, very strong opioid prescribed for post-surgery and severe end of life, things like that, appropriate to those conditions. But no, the fentanyl is coming in at the border, and the ingredients are being shipped to Mexican labs from China. So, I mean, there is interdiction work that needs to be done in this. It's so tiny, though, and so potent that it's really easy to sneak in. I mean, in the soles of someone's shoes, in the wheel well. I mean, we do need better interdiction, but that's not the sole answer to this. The Republicans would have you think that we got to stop the immigrants coming in at the border. I mean, because we still have 7 million people in America who wake up every morning going, how am I not going to be sick? How am I not going to be dope sick today? So we've got to deal with them. And that's a demand issue, not a supply issue. Until we make the treatments easier to access than the dope, this crisis is going to continue to skyrocket.
Wow.
That's it in a sentence. Treatment easier to get than the dope. So both things are important. But right now, the Republicans would have you believe that the only answer is to lock up the people who are using,
build the wall,
and then lock up the folks bringing it is. But until like the demand is lessened, they're going to still figure out ways to sneak it in.
Right. And I'll
A
just
lot of
add-
it comes. I hear a lot of it comes in the mail. The ingredients, you can mail order the shit from China. So I don't get too in the policy weeds of that, because I feel like I have enough work to do just with like the treatments. But from what I've read, and Sam Canoni says a new book called The Least of Us that's got a lot about fentanyl in it.
Mm-hmm. Right, because President Biden, he got Mexico to invest $1.5 billion into smart technology to secure the border, and they have seized pounds of fentanyl at the border. But like you said, I don't think you could blame this on any really politics. The problem is here now, and so how are we going to solve it? And and it's through work like your work, which I'd call education and information and entertainment at the same time.
Yeah. And empathy, that
and
humanity back into our institutions, and not just drug war mentality.
Right. We need to treat them like people with treatable diseases, like you said, because they are. And we all have our own addictions and our vices. And these ones are very hard to wean off without a helping hand. So, Beth, I just want to say again, also, I know you say the reason you became an author is because you wanted to just change one mind. If that's all you could do, just change one mind out there. You've changed my mind, my family's mind. It's just the way I view this whole epidemic through a human lens versus these people, I can't relate to them. No, I can relate. We can all relate to these.
They are us.
They're victims. They're victims, and they're being targeted. They are not addicts. I don't even like using that word anymore.
You're right to call yourself out on that. Thank you. This is probably the best conversation I've had since the book came out. This is really great.
Oh, Beth, I'm so honored to speak with you, and I can't wait to, well, hopefully you don't have to write another book about this, but you know what? You are the voice. But you need to go to Hawaii. Go to Hawaii.
My husband says, like, can you do a cookbook next?
Yes, do a cookbook before you write about fentanyl. Beth, thank you so much for coming on. I really appreciate it.
It was my pleasure.
You take care.
If you enjoyed this episode, don't forget to follow and subscribe to the show. Help spread the word about uncovering the truth by giving us a 5-star review and sharing the show with a friend. We're available on Apple, Spotify, YouTube, or wherever you listen to your podcasts. Thank you for listening, and as always, I will continue to uncover the truth. The Uncovering the Truth theme song was created and produced by Pokari.